Hello, my name is Dr. Kian Samimi. I'm a board-certified plastic surgeon, and I would like to talk to you today about breast reduction. Breast reduction is a very common procedure that I do, and it is one of the procedures that has the highest satisfaction. A breast reduction is appropriate for a woman who has problems related to the weight and size of her breast. These problems include back pain, shoulder pain, rashes of the folds, and others. Breast reductions have to be approved by insurance, and there's certain criteria that have to be met prior to qualifying for insurance. The breast reduction not only reduces the weight of the breast, but it also lifts the breast. There are different techniques to perform a breast reduction, but the most common one uses what we call an anchor incision or a Weiss pattern incision. It is an incision around the areola, a vertical incision extending from the areola into the crease, and then an incision in the actual crease. This allows me to reduce the size of the breast, to lift the nipple, and reshape the breast. I have to remove a minimum amount of weight for it to qualify as a breast reduction, but otherwise the ultimate size is between the patient and me. I cannot promise cup sizes with a breast reduction as there's no standards, but usually I'm pretty good in getting you to where you would like to be in terms of size. The breast reduction takes about 3 to 4 hours and is performed in an outpatient surgery center. It does not require an overnight stay. The recovery after a breast reduction generally tends to be fairly straightforward. The pain usually is not too bad and is easily controlled with oral pain medications. Most women are able to return to their activity, normal day-to-day activity, within a week. If their work involves heavy lifting and strenuous activity, the recovery may be longer. The incisions typically heal very well. I typically put on either a breast binder or a surgical bra in the operating room, and this has to be worn for about 6 weeks after surgery. I do not usually use drains, although sometimes I use drains, and they typically come out on the first visit about a week out. All sutures should be dissolvable with a breast reduction, and I use a glue on the outside to seal the incisions. The glue generally just comes off within a week or two. You can start taking showers about 48 hours after the procedure. Simply remove the bra and the dressings and get everything wet. And after the shower, just put the bandages back on or bandages back on and put the bra back on. Again, as I mentioned, the bra should be worn for about 6 weeks, a sports bra that gives good support. In the period after surgery, there definitely is swelling, and the breasts tend to be very high and very flat on the bottom. With time, the breasts settle and take a more natural shape, and also the swelling goes down. Sometimes I recommend to consider doing liposuction of the outside of the breast and the chest wall at the time of the breast reduction, as that fullness becomes more noticeable after breast reduction, and that can usually be done at the time of the reduction. Risks with a breast reduction really involve the nipple. The blood supply and the sensation to the nipple come through the breast tissue, and I do remove breast tissue during a breast reduction. So one of the complications of a breast reduction can be loss of nipple sensation or loss of the nipple itself. Both are actually fairly uncommon. Loss of nipple sensation theoretically should occur, but most women actually say they're more sensitive after a breast reduction. Loss of a nipple is rare but can happen, and there are certain risk factors which increase that risk. That could be, for example, a very droopy breast that needs to be lifted, where the nipple needs to be lifted for a longer distance, somebody who has underlying medical conditions such as diabetes and hypertension or high blood pressure. Definitely, smoking is a big, big risk, and would not proceed with a breast reduction if you have not quit smoking at least for 6 weeks prior to the procedure. The scars with time heal well. There are some scar treatments that we recommend that can be applied. It does take about 6 months to a year for the breast to settle. If there are raised scars, they can be treated with cortisone injections or maybe even with surgery if they don't resolve with the scar treatments. And again, most women are very happy with their results. There's a few things to keep in mind again. I cannot promise cup sizes. I have to take a minimum amount of weight off. No woman is perfectly symmetrical, and no one will be perfectly symmetrical after the procedure. And finally, the breast will require time to settle. Now, if you tend to gain weight after the breast reduction, the breast size may increase again, or if you lose weight, the breast size may go down. So ideally, you lose all the weight and stabilize your weight prior to the breast reduction. If you have any other questions, we'll be happy to answer them in a consult. All of my staff is very knowledgeable and should be able to also assist you with any questions. Looking forward to meeting you.